Welcome to the Good Good Podcast. I'm your host, Dee Talley, mama, licensed acupuncturist, herbalist, and embodiment coach. Here we dive deep into the realms of energy, consciousness, awareness, empowerment, and personal transformation to help you create a more vibrant and juicy life. Hey everyone, and thank you so much for joining me. This is the Good Good Podcast, and I am your host, Dee Talley. The call was loud. The call felt loud today, my friends. I've been doing a lot of recording for season 2 interviews, and it's been really amazing and fun to do all these interviews. But at the same time, I miss just being on here and talking to you solo. So I decided that I was going to come on and do a show, which actually it's kind of funny how I haven't actually talked much about my profession on here. It's been a lot about healing, wellness, embodiment, and more kind of generalized topics. But this show is going to be all about acupuncture and traditional Chinese medicine. And I did not go nuts with scripting and doing anything like crazy. You know, I've been a practitioner for almost 10 years now. And so I really want to talk to you like I would anybody else, like I would my patients. And I actually went to ChatGPT and I asked ChatGPT what are the top questions that people have about acupuncture. And it spit me out a bunch of different questions. So I'm going to touch on some of those. I'm also feeling really inspired by one of the interview podcasts that I did. And my friend Courtney Meisenheimer and I did a tarot card pull, and we used it to inform our podcast. And I was moved, so I bought the tarot card deck that she uses, and it's just beautiful. So I'm like shuffling it right now. You can like hear it in my hands. So I am going to do a tarot card pull for fun, and I would like to let it kind of inform what I'm going to talk about. And, I understand that tarot might not be, your vibe, or you might have feelings about tarot. And that's cool. You can just fast forward. And at the bottom in the show notes, I will put, where the time in which you can fast forward. So first and foremost, I'm going to shuffle the deck. Okay. So I'm going to pull the card, show it to you, and then I'm going to read the little book. Ooh, Father of Wands. Okay, so we've got a snake, a wand, and a bolt of lightning. And this is in the minor arcana. Let's see. The Father of Wands is a man of mystique and charisma. Others are drawn to him naturally, and he welcomes them with an open and loving heart. Usually you'll find him involved in the healing arts. As he's deeply compassionate and in tune with life and nature, he is able to hold steady and still during conflict. Father of Wands, charismatic, creative. Fascinating. Others are drawn to him naturally, and he welcomes them with open and loving heart. Am I the Father of Wands, guys? I like to think that I am open with a loving heart, very much involved in the healing arts, very deep compassion for people, for suffering, and in tune with life. Wow. Just for shits and gigs, let's pull another. That was pretty spot on, but I want something more. I want a little bit more here. Ooh, the World. The World is the last card in the major arcana. Okay, it says wholeness and completion. The World is the final card in the journey of the major arcana. It signifies completion, harmony, and contentment. It's rare to experience this energy as we are usually consumed by wanting, needing, and achieving. So when this card appears, contemplate for a moment the idea of being whole. Focus on the image on the card. Close your eyes and envision this radiating energy inside of you. What does it feel like? Where is it located? What blocks you from feeling a sense of wholeness each and every day of your life? Damn. In traditional Chinese medicine and just holistic medicine in general, there is this idea that you are whole just as you are. You don't need anything else. You've got all the goods inside of you. You've got everything that you need in order to heal, in order to be well, in order to be without pain, in order to sleep well, in order to function through the seasons, in order to stay healthy. You have everything within you. And this can be empowering, or it might feel like confusion if you are somebody who is like, well, then if I'm whole, then why are all of these things happening, right? You know, when you have a newborn baby and they can't really communicate with you, all they can do is cry. So you are supposed to interpret their needs by just the sound of the cry, or by, using your brain to kind of say, okay, has it been a few hours for the feed, and, wake window, blah, blah, blah. So newborn babies cry often. Similarly, our bodies don't always talk to us in a linear type of way. So the way in which that they talk to us is through symptomology. So it's the symptoms of what shows up that we often have to interpret and use our senses, our body, our mind, and try to understand, what is it that my body is communicating with me. I would never say that one should make them good or bad, like categorizing good or bad, because really it's just information. It's straight up just information that is coming in, that it's our jobs to kind of interpret that. But truly, we have everything that we need in order to heal. And if we can focus on giving our body a nice environment, it heals itself, which is amazing. So, okay, so I'm going to show you this card. This is actually a really cool looking card. Okay, I mean, spot on, right? So, let's talk a little bit about acupuncture and traditional Chinese medicine. When I first had an inkling about traditional Chinese medicine and acupuncture, it was because my sister was sick and she went through a bunch of different doctors. Nobody could tell her anything. She tried all the different diets. She did everything that was asked of her, and she still was not getting better. It was only when she tried alternative medicine that she started to get better. And ever since that time, we were young. I remember thinking, wow, there's so many different ways to heal. There's so many different ways to get better. I was always drawn to alternative things. Luckily, when I was going through school, I thought at first I was going to be a nurse, and then I thought maybe I was going to be a physical therapist. And I was living in Buffalo, and I was going to school for PT in the Doctorate of Physical Therapy program. And I was getting my bachelorate. This was before I was going to enter the doctorate program. And luckily, a couple of things. One, I was able to shadow, and I was able to see kind of how do physical therapists work, and is that something that I'm interested in. I shadowed at CVPH outpatient physical therapy, and I literally ran for the hills. Like, it was not a good fit. It was not a good fit. Luckily, in my bachelor's degree of exercise science, which was the pre-physical therapy program, I was able to, it was required to do an internship. So it was a 12-week full-time, 480-hour internship, and you could pick whatever profession you wanted, as long as it was in the kind of healing arts or, medical profession. And I remember my sister's experience, and I thought, hey, there's something to this. I'm kind of interested to see. And after trying to find somebody to take me on as an intern, I found somebody in Buffalo, Benjamin Nanzito, who is an amazing acupuncturist. I'm not really sure where he's at now, but it was a really amazing experience. And I learned a lot through that experience. And it was kind of one of those, it found me, where I was like lit the fuck up. I was like, wow, this is so amazing. Like, these little needles and this whole paradigm and how different it is. And so immediately I knew that I was going to be an acupuncturist. So I applied to the Finger Lakes School of Acupuncture and Oriental Medicine. And I actually only applied and visited one school. It was my first one on the list. I set up the visit. I went there and I just felt like home. It felt so good. And I loved it. And so I entered acupuncture school. And, acupuncture school was a difficult time because, well, for many reasons. For me personally, I was going through processing sexual abuse, and I was highly anxious, and I was also, tied to this outcome of needing to get a 4.0 and being perfect. And I was still stuck in like the no prize, which I've talked about before on here. I was also learning a lot about traditional Chinese medicine and about biomedicine and the healing arts. And it was really exciting and also difficult. I came away from that experience feeling like, wow, there are so many different tools in order to heal. And I was really riveted by that. In the time that I've been in practice, I have seen thousands and thousands of patients, which has been really, really amazing. I want to answer some common questions about what is acupuncture, why might somebody seek acupuncture, what are we actually doing, does it hurt, how many treatments do I need, what conditions do you treat, do I have to believe it in order for it to work, what should I expect during my first session. So traditional Chinese medicine has been around for thousands and thousands of years, and people always ask me, well, does it work? Well, yeah, it works, or it wouldn't actually be around at this point. It would be phased out because if it really didn't actually work. And what's fascinating about this is I've always thought like, well, how did they know which points do what? And it actually turns out they started using different points and recording what they saw. And so after thousands of years of getting this data and this information, they came up with this classification of what the point does and also the framework of the meridian channels, which for anybody who doesn't know what the meridian channels is, the meridians are basically like a highway in which qi and blood flows. And the acupuncture points are located on the meridian channels. There's many different meridians, and they usually correspond to an organ system. But there's also a couple of other different channels as well, and there's extraordinary channels too. So it fascinates me how this is how it was figured out. Through thousands of years, we've seen that this point helps to stop cough. And so it was based on real life clinical work, which is really, really amazing. The paradigm of traditional Chinese medicine takes into account the disease process as well as the constitution. And the constitution is basically the patient's proclivity or tendency towards how they would get sick and what that might look like. For example, the best example that I can use is an illness. So if 10 people are exposed to the same exact virus, each body is going to present in different ways. One person might get a choking cough. The next person might have a little bit more phlegm. The next person might have had a fever. And even though the framework could be similar with the viral infection, there are little nuanced differences. And this was another reason why I was drawn to alternative medicine, because I always thought it never made sense to me how when there was an illness, you would get this particular protocol. And it's kind of like a one size fits all. Like, okay, you have high cholesterol. Here is a statin. You are having trouble with your cycles. Here's some birth control. You have this nerve pain. Here's some gabapentin. I felt like it was like a flow chart of if A, then B, where it never made sense to me, because in life, when is it ever if A, then B? The healing process is like up, down, better, not better. It's not really simple as like walking a line. Now, that's not to say that many people are, healed or helped by conventional medicine. And thank God for that. I mean, if you break your leg or if you cut yourself and need stitches, you're not going to go to your acupuncturist. I'm not a purist. I love conventional and Western medicine. There are some moments that I don't love it. And I can explain more. I could probably explain that for dozens of podcast episodes, but nobody actually wants to listen to that. Maybe. And if you do, then tell me and I'll do a show on that. What fascinates me too is in conventional medicine, things are broken up into organ systems in a way that's like very separated. If you have GI, you go to gastroenterology. If you have anything woman related, you're going to go to the GYN. If it's musculoskeletal, you're going to go to physical therapy or occupational therapy. It's kind of separate in a lot of ways. And I'll never forget the time that I was doing gross anatomy cadaver lab dissection, and I was in Buffalo. And the first time that I opened up a body cavity, was cut open, and it's like you gaze inside the body cavity. And I was so used to learning anatomy and physiology based on like color-coded organs, seeing so clearly the, bile duct and like the vessels and all these things. And it's like when you gaze upon an open body cavity, all of that is just packed in there all together. And to think that it doesn't interact with each other or to think that it needs to be separated out, I never quite understood it. And so this is part of the reason why I love traditional Chinese medicine, is because seemingly symptomology that doesn't seem related is often related. And we call it in TCM disease patterns. So for a given condition, there are multiple disease patterns or multiple etiologies, causes of why that might be happening. And so this gives traditional Chinese medicine a leg up, because if we can look at the constitution and we can look at the symptomology and we can look at the disease patterns, we can figure out the root cause of why the disease and the illness is occurring. This to me blew my mind, because in conventional medicine, oftentimes it's very much symptom or branch treatment. We are treating the branch. We're not treating the root. Oftentimes we're working with symptomology, not root cause. That's kind of a blanket statement. And yes, there are times where there's cures, quote unquote, right? And probably the best cure is like surgical, right? If you have cancer and they remove a tumor and you're cancer free, that is a cure. But when it comes to disease, two things, right? We're treating the root and the branch, which means that even if you come to acupuncture for a short time, the gains in which you see are long-term, because we're not just taking away symptoms, we're also treating the root cause, which is awesome. And preventative medicine, because if we also know the tendency towards dis-ease, then we can see down the line, okay, what might this patient be subjected to that would make them sick? We can see it. We can see it with nature in season change. We have these ideas of zooming out and looking at it from the big picture. I hope this is making some sense. I feel like for me, it's so ingrained that sometimes I think everybody knows about this or everybody thinks about it in the same way, which is kind of silly, which is why I'm doing this podcast on it, right? So what is acupuncture? So we're sticking single-use sterile needles that are very, very thin, like about the width of a human hair, into acupuncture points, which reside on meridians. In order for me as the acupuncturist to do a good job, I have to first speak to my patient, observe my patient, and you'll notice that I have an eagle eye. And I also have gifts energetically where I can pick up on things extremely easily. I have to speak to my patient. I have to look at my patient. I have to touch my patient. I have to look at their tongue and feel their pulse. So these are further diagnostic techniques in Chinese medicine. People always ask me, well, what do you feel for, right? Or what do you look at? So when we're looking at the tongue, on the tongue, there are regions that are ascribed to different organ systems. For example, the sides of the tongue are ascribed to the liver. The tip of the tongue is the heart. The back of the tongue is the kidneys. The very center of the tongue is the stomach. So when I'm looking at the tongue, I'm looking at the color. I'm looking at the texture. I'm looking at the fur. I'm looking at any different landmarks, sores, bumps, color changes, areas of dryness, areas of wetness, areas of too much thickness of that fur. I'm also looking at the face, right? So I'm looking at the lips, I'm looking at the eyes. The Shen or the spirit is reflected in the eyes. When I am diagnosing somebody, I am looking at them. I'm energetically attuned to what is going on in the room. And this allows me to come up with a traditional Chinese medicine disease pattern diagnosis. From the disease pattern diagnosis, what I do is I create a point prescription. The point prescription is basically 5 to 15 acupuncture points that are usually needled bilaterally, which means on both sides of the body. Acupuncture is a therapy where we use single-use sterile needles to insert into acupuncture points. Now, the point is to stimulate the point. The tool is the needle. So if you've ever heard of acupressure, what we're doing is we're just pressing on the points. There's also, for pediatrics, I often use acumagnets, which are really high power magnets that I tape to acupuncture points. I use this for people who are really needle sensitive. I use this for young children. You can also tap. So doing like tapping on the points. So any way that we can get stimulation to these points is how you are going to help give your body a little bit of a boost in order for it to heal itself. Like I said, branch and root. So we're treating the root cause. The branch is simply the symptomology. Does acupuncture hurt, right? Because these are needles. We're inserting needles. And also another follow-up question is, what's on the needles? I get that one a lot too. I like to say that most people think that it feels like a mosquito bite. Like something is happening on the surface of the skin during insertion, but it shouldn't feel like a hypodermic needle stick at all. So once that needle goes through the skin and we get it to the depth that we need it, there may be sensations of deep, dull, aching, distending, or movement sensations. This is all completely normal and actually good. We call this de qi. It means that we got the qi to the needle. So that deep, dull, heavy, achy feeling is actually a really good sign. Now, it's on a spectrum, so some people feel that a lot and some people don't. And I can also do manipulations of the needles to get those sensations more or less. Once the needle goes through the skin, you can also expect to feel movement sensations. Some people actually feel different areas of either their blood moving or like there can sometimes be little pangs or twinges here and there. And that's simply just feeling the areas in which your body has stagnation. And there can also be heating or cooling sensations. And normally for most people, it's heating sensation as flow is freed up. You can think of the meridians as pathways, like waterways. So if there is stagnation, there is pain. So when you start to move some of that stagnation, what you get is a freer flow. So this is why practitioners of Chinese medicine love heat. We love increasing flow to areas in order for them to heal more quickly. Now, some people, when they close their eyes, when they're receiving acupuncture, can get either flickers of light, different colors, and I kind of like equate this to like it looks like a lava lamp where you can just see different colors kind of floating in and out. For some people, acupuncture can be a really wild experience where they see different things or they hear different things. And I'm not trying to freak people out, but you know, it's a really deep way in which to connect to your body. And it has this beautiful way of bringing your energy in and down, which allows a sense of rootedness and groundedness. And this can be a really beautiful thing. The other thing that acupuncture does is, well, a lot of people don't know this, but we have what we call endogenous opiates in our bodies. So endogenous opiates are pain relieving chemicals that the acupuncture needle helps the body release and use. So this is the main reason why people who receive acupuncture often feel high. I like to say it's your own brand. This is your own brand of high. And so again, this is on a spectrum. Some people feel that a lot. Some people don't feel that as much. I'm always fascinated by the subjective experience of people when they are receiving acupuncture. Now, what shouldn't you feel? So you shouldn't feel anything stabbing. You shouldn't feel burning. You shouldn't feel nerve pain. You shouldn't feel anything that's sustained, really painful. And if something feels like it's painful, I always say, you're never going to offend me if you tell me something's not right for you. And, this isn't like a no pain, no gain. While in areas of high stagnation, there may be some discomfort. There's a difference to me between discomfort and pain, all of which should be communicated to your acupuncturist, because there are things that we can do in order to create more comfort if that is what is called for. So if something feels uncomfortable to the patient, normally I say, okay, give it a few seconds. If something's really uncomfortable and I immediately yank that needle out, it usually makes it a much more uncomfortable experience. So you can imagine that any areas in which there's higher nerve endings, the needling process could be more uncomfortable. So for example, tips of the fingers, face, toes. These are areas that might be a little bit more uncomfortable, a little bit more twingy or zingy. But that should never be a sustained feeling of discomfort. The feeling of discomfort is mostly just on the level of the skin's surface. And once that goes through the skin, those sensations typically transition really, really quickly. Now, some people with different conditions are really more sensitive and more heightened, and that does happen. The other thing that happens is for women, they are often more needle sensitive in their ovulation and during their period or right before their period. So I always communicate with my patients and say, hey, you're about to start your period. This might be a little bit more uncomfortable. Please communicate with me and let me know what's right for you. So essentially, acupuncture induces feelings of pain relief, relaxation, and opening up of flow. How does acupuncture work? So I was talking a little bit about the kind of TCM understanding of how acupuncture works. From a Western perspective, you can think of acupuncture by increasing circulation and having a direct impact on the body's systems, for example, the nervous system. So what we're doing is we are gently shifting the body from a sympathetic sort of fight or flight to a parasympathetic rest and digest, often happening pretty quickly. And we're working with the body's system. So the hormonal system, the spinal cord, the muscular system, the vascular system, in order to bring the body closer to homeostasis. Now, there's different points that do different things, obviously. So it is my job as the acupuncturist to, like I said, speak to my patient, feel their body, look at them, create a diagnosis, pick the appropriate points, and do the appropriate treatment. Now, you'll never actually receive the same treatment twice, ever. Why? Because your body's ever changing and it's never going to be the same. And as it heals, oftentimes it's kind of like peeling an onion where, symptoms transition and sometimes new symptoms arise. And it's a really, really interesting experience for people. is acupuncture safe? So I'll tell you about the side effects of acupuncture and the risks of acupuncture. When I do my informed consent with a first-time patient, I like saying the risks from minimum to maximum, and then I like telling them the benefits, because most people don't know that informed consent also includes benefits. So this would be a good time to tell you that traditional Chinese medicine is made up of different pillars. So I'm an acupuncturist, but I do more than acupuncture. So the pillars of Chinese medicine. So yes, of course, you have acupuncture, you have Chinese medical massage, it's called Tui Na. In this category includes our other soft tissue work, so cupping and gua sha. There's moxibustion, which is a warming therapy using mugwort, which is a Chinese herb. Herbal interventions, so using traditional Chinese herbs in order to create formulas to help with healing. Eastern dietary therapy and lifestyle interventions is also a pillar. And then you have movement like Tai Chi and Qigong. So these are all pillars of traditional Chinese medicine. And I like to talk about the risks of treatment as I go, because I never want to overwhelm a patient. If I sit there and explain every single risk of every single thing that I do, it can be really, really overwhelming. So let's talk about the risks of acupuncture. And it always confuses me why a lot of times, like, acupuncturists are nervous to talk about the risks, or, think that's going to freak your patient out. I always like to give my patient the benefit of the doubt. And, legally we're required to explain the risks of what we do. The first risk, the most minimal risk, is pinpoint bleeding or bruising at the site of the insertion. Now, the needle does not have a cutting edge. It's not like a hypodermic needle. It's not meant to put anything into the body or take anything out of the body. It is a teeny tiny needle that, because it is such a small needle, when I say pinpoint bleeding or bruising, I mean pinpoint. Probably some of the biggest bruising I've ever seen from acupuncture is like the size of a nickel. And sometimes even if acupuncture bruises a patient, the needle isn't even thick enough for the blood to come out of the skin. And so what that does is it leaves a small little hematoma that gently reabsorbs. So that is the first risk, pinpoint bleeding or bruising at the site of the insertion. The second risk is fainting. Now, this often occurs if, one, you faint easily, and two, in a seated position with acupuncture on the scalp. Now, all my patients receive acupuncture lying down, whether it's lying down face up or face down. Fainting can often be prevented. So if you are receiving acupuncture and you start to feel funny, you start to feel dizzy, sweaty, your heart starts to race, or something changes about your vision, it is really important to communicate that, because typically if we can stop the treatment, remove the needles, get you a glass of water, etc., this can be prevented. So again, always important to communicate. Third is infection. Now, I do use single-use sterile needles. There's no reuse of needles. There's no autoclaving. It is all biohazard. So that is our third risk of acupuncture. Our fourth risk, our most serious and severe risk, is organ puncture. Now, obviously, there are different depths and angles of insertion in the chest and the abdomen, of course. The needles do not go deep enough in a perpendicular plane to pierce organs if your acupuncturist is well trained. Okay, really important. Most people don't know that the apex of the lung actually extends really, really high into what we would consider the trapezius. So if I did deep insertion acupuncture at the top of the trapezius going downwards, there's a very, very, very good chance that I would give you a pneumothorax and you would have to go to the hospital. There's different depths and angles in which we insert acupuncture needles, like I said, over the chest and abdomen, as well as the back. So in the rib area, we would never put a needle deeply over the areas of the lungs, for example. Okay, so again, really, really important to have a well-trained acupuncturist. I cannot stress that enough. It baffles me how there are multiple professions that are able to take a certified acupuncture course, which, guys, it's a weekend course. You can't learn how to properly, safely perform acupuncture in a weekend course. I mean, even when I first started even handling acupuncture needles, like, it was so clumsy because they're so thin and fine. And in order to, properly handle them, it takes a lot of practice. The needles are made of a filiform wire, which means that they are very, very bendy. So if they hit a structure in the body, oftentimes an acupuncturist is very much attuned to what it feels like from their perspective on the needle. And if you go to somebody who is not trained properly, I don't recommend that for many, many reasons. Okay, so those are the risks of acupuncture. Now, are there side effects to acupuncture? So yes, there are side effects to acupuncture, most of which are positive. So and this is benefits, right? So increased blood flow, increased healing, better functioning digestive system, promotion of sleep, regulated cycles, pain relief, a calmness, a feeling of well-being and spiritedness, and this ability to be more in touch with your system, with your body. It can help with sweating of the hands and feet, sweating, night sweats, all different ways. Acupuncture can be extremely, extremely helpful. There are some people who experience fatigue, and I've even seen acupuncture. This actually is mostly for people who have autoimmune conditions. They can sometimes feel like acupuncture makes them feel like they're getting sick, like they're getting an infection. And this is always really important to educate on. So the sense of either feverish or chilly, or feeling like extreme fatigue, or maybe sometimes aching. And achiness and soreness can also be a side effect as well. Typically, that reaction is very short-lived. And this is kind of along the lines of a Herxheimer reaction. So anybody who has Lyme disease or is familiar with Lyme, it basically is like a shedding. Herxheimer is a shedding of the virus. And so what happens is there can be this sort of toxic load as the body is transitioning towards homeostasis. Acupuncture is kind of like a big kick in the pants to start that process more strongly. And for people who have dysfunctional immune systems, can feel side effects of acupuncture. Now, I have also seen the fatigue side effect, because acupuncture for some people causes a really strong increase in energy, where they feel really energetic. And I always tell people that it's like putting pennies in your piggy bank. So you don't want to spend all those pennies at once. So if after an acupuncture session, you immediately go and you push mow the lawn, and then you go shopping, and then you stand on your feet for 6 hours meal prepping, and then you can see how on the other end of that, once you crash, you will be exhausted, right? So again, think about it like putting those pennies in your piggy bank. Don't spend your pennies all at once. Okay. How many treatments will I need? This is a really good question. So in TCM, typically it's related to how long the condition has been around. So if the condition has been around forever, or if it's a late stage condition, the treatment will most likely be management, right? Typically, we like to say that you would be in treatment for as long as you had the symptom. So if this is something new that happened, 2 months ago, then I would say 2 months of acupuncture. Obviously, it's body to body, and it does matter how you treat yourself outside of the treatment room, obviously. The goal is not to go to acupuncture forever. The goal is to heal, to feel well, and then to use your lifestyle and your diet and your routines in order to sustain the change And, maintenance to me, 4 times a year during season change, there are many, many people who like having acupuncture once per month. Now, and for some, I do consider that management, because we may not necessarily be treating like a main chief complaint. We are treating the constitution or the patient's tendencies towards certain things. Or some people like coming because they have extremely stressful lives, or they, their lifestyle just isn't supportive of what we're doing, and so they keep coming in order to keep feeling those changes. Now, sometimes this creates some very interesting conversations of, well, how are you supporting yourself outside of the treatment room? I never actually want it to feel like passive care, where the person just comes in, I pop a few needles in them, and they leave. When we're talking about true healing and true wellness, there are more components to that. There are more lifestyle components to that. There are more routine and dietary components to that. And it's really important. So what I will say about how many treatments do I need is it depends. Acupuncture is best done in a course of treatment. So what's most important is that you come in regularly at the start. Now, again, that's not to say that you won't have benefits from coming just once and then never again, but what happens is we start to gain momentum. So if you come after a week, things will get better, and then they kind of go back. And then you come again, second treatment, things get better. Oh, it's been more days in a row that they were better. Now we're kind of backsliding. And so it creates a curve. And the goal is that the complaints for the reasons for coming in starts to get more and more and more and more spaced out. It's almost like riding a bike, where eventually your system takes everything that we're doing, assimilates it, and then you sustain the change by your diet, by your lifestyle, etc. What conditions does acupuncture treat? Now, acupuncture, and I'll say generally, and then what I like to treat. So acupuncture treats so many things. In my practice, I would say that pain is probably the biggest complaint that I treat. Neck pain, shoulder pain, hand pain, hip pain. And these are many reasons for pain, right? So it's not just like a one size fits all. Oh, you have hip pain, let me pop a few needles at your hip. That's the other thing to mention, which I didn't mention before, is most times, we use the channels and the point prescription to do the acupuncture. So yes, while you can expect points at the areas of pain, you can expect points at other areas as well. So pain is probably the number one. Anxiety and depression, sleep conditions, GYN conditions like painful periods, fertility issues, bowel problems. So whether that be like bowel conditions, or you have diarrhea all the time, or IBS, etc. Allergies, lung conditions, or you get sick all the time. I like treating pregnancy-related conditions, and I like doing pre-birth acupuncture for labor prep and holistic induction techniques. Pregnancy is a really magical time. It can be difficult in a lot of ways, and it can also be very, very taxing, and it is very, very taxing on the body. And there are ways that your body would normally be doing these processes as your body gets ready to give birth. Acupuncture helps to reinforce those changes and to give the body a little bit of a nudge in those changes. And so that is one of my favorite populations to treat. I also really like treating, it's almost like not even a condition for me. It's like an avatar. The avatar that I like treating best is a patient, male or female, because I have quite a few males in my practice as well, who actually wants to heal, who's curious, who wants to run the experiments, who's really open and honest with themselves and has their eyes open. And if their eyes aren't open, their eyes are beginning to become open. Those are the types of patients that I love working with. It can be so exciting. The patients that I dislike working with the most are the patients who blame others and are in a very strong victim mentality where they almost are addicted to their pain or tied to their pain, or they're one with the condition that they have. That is a really tough one for me because it takes the ability to zoom out and to see, no, I'm actually separate from that. You know, the ones who don't think they can heal, that is the patient population that I struggle to work with the most. And that is the patient population that we have the most discussions about whether or not I'm the right fit for them and what they actually need or don't need. Do I have to believe in acupuncture for it to work? No. No, you don't. The acupuncture works regardless. And actually, it's kind of funny. I enjoy having those conversations with people that don't think that it's going to work, or who think what I do is, stupid or a waste of time, energy, effort, money, etc. You don't have to believe in it for it to work, but I think that believing creates a level of openness energetically. And if you can transition into being open, your tendencies to heal and your ability to heal will happen faster. That is just an observation. That's anecdotal. I don't have any studies to kind of back that up, but after thousands and thousands of treatments, that is what I gather. What should I expect from my first session? So for a first session, you would come in we would start with a consultation where we talk about your health history for about a half hour, and it's pretty extensive paperwork. I have my patients complete the paperwork prior to coming in, so that way I can have an understanding of what's up before we start talking. So it's a half an hour, and then we go to a treatment room and we do full body acupuncture and sometimes extras. It depends. If the patient has never had acupuncture before, I usually like to start with just acupuncture to see how they do before we add a ton of other stuff in. And then for other people, it depends on the patient, I guess is what I would say. So that second part, so the part where we go to the treatment room and do the treatment, is about an hour. So my first initial patient appointments are 90 minutes long. And then follow-up appointments, I offer a 60-minute and a 90-minute. In a 60-minute appointment, the patient comes in, we go directly into the treatment room. We talk for about 10 minutes. This is just a brief check-in. Hey, how'd you do? How did it go? There is a framework of questions that I ask regardless of what's going on. So the most important things that I ask about the condition of why they've been here. I also ask about sleep, digestion, stress, cycle. And there may be a couple of other odds and ends questions in there, but I really, really want to know those main staple things. And food, nourishment, food and water. I usually don't recommend that you have something scheduled immediately after for a few reasons. First reason is your body's in flux. So you might feel different and you might feel relaxed, and, to have to rush off to work or to have to, go to an exercise class or something, it's just not recommended. I usually recommend just having kind of an open space that you can kind of float on out and be with yourself. I do have some patients that do schedule acupuncture prior to work, and that's okay too. It comes down to kind of what they're able to do in their schedules, and that works for some people. God, some of these questions on ChatGPT fucking cringe. Are the needles reused? Oh my God, no. Clean needle technique, no. They're not reused. They're all biohazard. No autoclaving, no reuse of needles. How deep do the needles go? Ooh, it depends on the point. It depends on the body area. should I freak you guys out? The deepest, the longest acupuncture needles that I have in my practice are 7 inches long. Now, before you flip, the 7-inch needles are meant for the glutes, okay, your butt cheek, right? So in order to get to the points, we need to actually go into the points, which is deep to the muscle layer of the glute. Depending on how much tissue is there will dictate the size in which I choose for needles. The typical standard size needle that I like choosing is 1.5 inches. Now, the 1.5 inch needles do not go all the way up to the handle by any means. Every single body is different. And so if somebody comes in, they're very, very petite, they don't have a lot of adipose tissue, they don't maybe even have muscular tissue on them, I would choose thinner needles. So I'd usually go for 1 inch needle or a 1/2 inch needle, usually 1 inch. For points on the face, points on the ears, points on the fingers, I go with 1/2 inch needles. And again, they're never needled up to, because this is part of clean needle technique, you would never put the needle where your fingers had been on. So the needle is never up to the hilt. Oof. What's the difference between acupuncture and dry needling? This is a hot button topic in the acupuncture world because dry needling is acupuncture in motor points or in muscular knots. So dry needling takes the finesse, the framework of TCM, the disease patterns, the diagnosis, the palpation of pulse. It takes all that out and it just uses needles for just knotted up areas, for just motor points to have muscles firing off. A very, very different thing. In acupuncture, there is a type of point called an Assure point. The Assure point is simply the motor point. It's simply the knotted point. So we do dry needling in acupuncture, but dry needling does not do traditional Chinese acupuncture. So what's tough about this is dry needling is one of those things similarly to certified acupuncture, where it's like it's not much training. So there are different professions that are able to do dry needling without being licensed acupuncturists. So people in the acupuncture world get a little kind of upset about this for many reasons. The other thing is dry needling is often, like I said, it's done by people who, aren't well trained or, and this is kind of false too, because it's not a blanket statement. There are amazing clinicians who do dry needling who are extremely well trained, but the vast majority of people who do dry needling are not as well trained as acupuncturists, simply because our training is a 3-year, year-round, so it was on a trimester-based program, and it took 3 years. It equates 4.5 years of regular college. And for me, I got 2 master's degrees. I got a master's degree in acupuncture and I got a master's degree in Oriental medicine. The Oriental medicine encompasses the herbal training. So if you can get a dry needling course done in a weekend, that is freaky to me. That is freaky in so many different ways. Acupuncturists already do dry needling, but what is freaky is the level of, and I've seen too many YouTube videos on this, where the needling looks extremely aggressive because the clinician in dry needling is going for a muscle fasciculation. A muscle fasciculation means that the muscle fires. So it's going for this kind of like contracted muscle. And this is helpful in a lot of ways because a muscle that is fasciculating without the patient firing it off actually is sending messages to the spinal cord in a feedback loop saying to the muscle, relax. So it's helpful in like spasms or in extremely tight areas. So I'm not saying that dry needling isn't great, but I think it's like I said, it's a hot button topic. It's kind of like taboo. A lot of people aren't clear on the differences, and for somebody who has a fragile ego, it might be a little bit uncomfortable for them. Are there scientific evidence that supports acupuncture? Abso-fucking-lutely there is. There's tons of research nowadays. When I first got out, there was less, obviously, but the studies show that acupuncture does everything I'm telling you: reduces pain, improves sleep, regulates hormones, helps with inflammation, helps with management of chronic pain, migraines, anxiety, fertility, all the things. Yes. What should I do before an acupuncture session? So always have something, a little something in your stomach. So I never want to, and I've actually sent patients away from this. If you haven't eaten all day, or it's been hours and hours and you haven't had food or water, it's not a good idea to receive acupuncture. Light meal, loose clothing, hydrated, avoid substances. Obviously, medication is okay, especially if it's prescribed by your doctor. Avoid tons of caffeine, avoid alcohol, and be ready to receive. A lot of people come in and they say, oh no, I didn't shave my legs, or my toenails aren't painted, or don't look at, this area of my body because, and none of that ever matters to me. I just care that you're there and ready to receive. I don't need bells and whistles. I don't need you to shave for me. And in fact, I hardly notice. And also, I haven't fucking shaved either. I just encourage people to come as they are, to be honest with themselves, and to be ready to receive. That's plain and simple. That's it. Now, I want to talk a little bit about adjunctive therapies when it comes to traditional Chinese medicine. So just kind of like a brief rundown. So custom herbal formulas. So there's different types of administration of herbs. There is pills. So they're pre-prepared products. There's granules, which is basically like a dry powder that you add hot water to, like a tea. And then there's raw, where you get the, leaves and sticks and twigs and, all of the constituents in a bag, and you decoct it, which means that you fill a pot with water, you add the herbs in, and this is basically like cooking. So there's pluses and minuses to each administration of herbal medicine. So the plus to pre-prepared pills is it's easy. You can carry the pill bottle around. It's super simple to take. And this is obviously if you can swallow pills, okay. Because Chinese herbs, it's a higher pill count because you need more of it to, pharmaceuticals are pretty much based on herbs. However, they are synthesized, they are concentrated. And so what would take one pill takes, a raw herb or even a prepared herb, like 3 to 4 pills is considered a dose, and you have to take 2 of those a day, right? So ease of use, and if you can swallow pills, no, that's great. The drawback of pre-prepared pills is I can't modify it. So a traditional Chinese herbal formula is comprised of multiple different constituents, different herbs that together make up the formula. This is the magic of TCM herbs, is there are different herbs that do different things when they're put together. They're called duiyao. It means that they increase a function of the other herb, or they kind of meld with it in a synergistic way. And so I can't modify pre-prepared pills. I have to go with a traditional formula that's already written, that's already formulated. And for some people, that's fantastic, and I don't need to modify it. And for other people, it's not going to work the way that we need it to work. So for some, we have to have 2 different types of pills. We have to vary the pills up. So this leads me to granules. So granules are a powdered form of the herbs that you mix with hot water to create a tea. Now, the positive part of granules is that they can be modified, and I can write them out like an herbal formula. They're also fairly easy to use. All you need is hot water. The drawback is for people who have trouble with taste or texture, it can sometimes be a little bit difficult. You have to get them in twice a day. So you have to do it with hot enough water that it actually helps to create a homogeneous mixture. So if you don't use enough water, it's grainy. It's kind of like, can be like grainy or chewy almost. So you want to have enough water. However, if it tastes bad, some people don't want to have a lot of water. You can see where I'm going with this. So taste and texture. So I always say it's better to get them in than not get them in at all. So if you're going to, upchuck your granular herbs because of the taste and texture, then I would recommend pills, and we would get as close as we could with that. The third method is the raw decoction. The amazing part of this is it can be modified, so it can be written custom. And this is the gold standard in Chinese medicine. So if you were to go to China, this is what you will get. You get a big bag of herbs that you would be required to cook. Now, in the Western world and conveniences and the fact that, cooking is hard enough for some people, that raw herbs can be a little bit more difficult because you have to cook them every few days. And it takes 30 to 40 minutes to do. And then straining off the liquid and throwing away the dregs and keeping that liquid with you to drink 2 to 3 times a day. So the drawback of this is one, taste. So you're getting the full taste of it. Not as much texture, right? Because it's strained. And the ease of use, it's a little bit higher difficulty level, right? It takes a little bit more effort. So that is the drawback of it. Now, for most patients in my practice, do either custom granules or pills. Rarely do I have patients who are willing or want to do raw herbs. I'm always excited when they do. Herbal medicine is an amazing adjunctive therapy to everything that we're doing. And I think of it like supplementary. It really helps in the meantime, right? So if there's big spaces between acupuncture sessions, it can be really helpful to keep forward progress and to keep momentum. Cupping therapy is indispensable to me in my practice. It's probably one of the most used therapies that I use in addition to acupuncture. And cupping, I do a technique called fire cupping. Now, cupping is basically, imagine a glass cup, and I'm using the flame to go in and out of the cup in order to suck the oxygen out and create a suction cup on the skin. When you put a suction cup on the skin, what happens is the tissue gets sucked in, the muscle layer gets pulled up. Any stagnant qi and blood that is hanging out in the muscle layer comes to the surface. It allows brand new, fresh blood to reperfuse the area. It increases flow. The main risk associated with cupping is a therapeutic of cupping, which is bruising. Now, the bruising, like I said, is occurring because the cup is breaking small vessels that cause that stuck blood to come up to the surface. This main risk is also diagnostic, because if I cup a patient, I'm going to be telling them, I want you to watch these marks and see how quickly they clear. So it's diagnostic to me to be able to tell, did they clear extremely fast? Did it take forever? What is the level of flow like? And further, what do the cupping marks look like? Are they super dark in color? Are they black, almost dark purple or black? Are they bright red and angry looking? Are there any marks, right? So these are all diagnostics to the patient that will help inform treatment. The other side effect is soreness. Now, most people find cupping to be comfortable. However, some people find it uncomfortable. And this, I like to say, is like a hurt so good, almost like a deep tissue massage. If it's hurt so bad, that's something that we need to be in discussion about, right? Because we're not trying to hurt so bad, right? And I feel like my athletes can really understand what I'm saying with that. Soreness can persist for a day or two. You should never have soreness more than 48 hours after cupping, ever. Unfortunately, in this area of the area that I live, I've seen some pretty extensive cupping injury. And I think this comes down to training, and folks, more is not always better. Leaving a cup on a patient for, 10, 15 minutes is not indicated, should never, ever, ever be used. The type of cupping that I like to use is slide cupping and stationary cupping. So slide cupping, I basically put oil down on the skin first, place the cups, and then move the cups around. I like this for multiple reasons. One, surface area. So if we cup in this area, we're able to get the whole area. We're able to work with the whole back. And it also creates more movement, more flow through the area. Okay. And then stationary cups is where I place the cups and leave them for a length of time. Sometimes move them to different body areas or to different points in the area that I'm working at. I'm mainly thinking about, stationary cupping on the back, where if we're going to do the whole back, I'll sometimes move them down as I go. There are various different forms of cupping. My cupping training was extensive, and it can be used in multiple areas. It can be used on the face and on the chest and back and legs and, stomach and everywhere, right? Everywhere. Cupping is amazing. Moxibustion is a warming therapy that I use, and this is an amazing therapy for arthritic conditions. It helps to warm the area. It's thought that the smoke that comes from the mugwort plant has infrared qualities to it, where it actually is very penetrative to the area. So anytime in which cold is a diagnostic in a condition, moxibustion would be indicated. For example, if you have abdominal pain that is alleviated by a hot pack, moxibustion would be useful. And you can use that across the board, right? Like I have shoulder pain, but when I put a heating pad on it, it feels so much better. For the people who can predict the weather with their joint pain, moxibustion is amazing, indispensable therapy. And it can be used for so many different conditions. It can be used to flip breech babies and to, help with flow and movement and create warmth and chase out cold to the channels and help warm digestion for people who have diarrhea or low digestive fire where they gain weight. It's a really amazing therapy. Different types of moxa, and this is kind of scratching the surface. I feel like I could do shows on each of these, but I'm trying to just give you a really quick kind of rundown. Okay, so Tui Na, which is TCM massage, very, very different from regular massage. So it's usually performed over clothes. It includes a lot of different hand techniques like pushing and rocking and grasping and goldfish rocking. And in my practice, I do a combination of body work because I do a lot of cupping. So oftentimes when I'm putting oil on, I'm doing multiple different techniques at once. And it's just amazing stuff. Helps with flow, helps with pain relief, and isn't used for everybody, but like I said, it depends on the patient. It depends on the condition. Eastern dietary therapy, this should be its own show. Eastern dietary therapy is using food to heal. And it really speaks less to the caloric measure of food and more to the energetic of food. For example, does the food warm the body? Does the food cool the body? What does the food do, right? So for example, ginger, whether you eat it hot, whether you eat it cold, is still energetically hot, right? So when we look at our disease patterns, we can come up with foods that will help. Like food is medicine, right? Eating with the seasons, extremely, extremely important because we are a microcosm of the macrocosm of the world, right? So by eating with nature, by eating with the seasons, our bodies are going to be able to more easily digest and assimilate that food. I have seen some amazing, amazing cases come through my doors, and I should probably do a whole nother show of cases that stand out to me. I just love this medicine. I love the way that it works. I love its ties to nature. I love how it's very least invasive and preventative, And probably the best part of my work is watching people's ability, watching their connection to healing themselves. So for me, I am simply the conduit to which this medicine flows. I'm not the one doing it. I'm not the one doing anything, guys. It's your bodies that are doing the hard work. I'm the conduit. I'm just pushing buttons and saying, come on, you can do it. Heal. Let's go. Your body is the one that's actually carrying out the processes. And it never gets old to me to see the way in which people heal. And to hear the stories of people who this medicine has helped, it lights me up. It lights me up. It's all encompassing. It's all encompassing in a lot of different ways and can make a extremely huge impact. And I am really fortunate to be in this work and to do this work every day. And I'm amazed by the bravery of patients who are willing to be vulnerable enough to accept this type of healing. If there are any areas of the things that I spoke about that you want to learn more about, or if you have any show requests for other TCM or acupuncture shows, I'm really happy to do it. First and foremost, I'm a licensed acupuncturist and an herbalist, and I help people heal. But I'm also realizing in a lot of different ways over the past couple of years that the ways in which the body heals are ever expanding, and it goes beyond just TCM. I encourage you to remember that you, my friend, are whole. You have all the goods to heal yourself. And it turns out that you may just need a little bit of coaching, a little bit of help, a little bit of guidance to get there. But my friend, you have everything inside of you to heal. It comes down to the ability to tap into what is right for you and to do those micro experiments to see how does your body thrive. Thank you so much for joining me, and I will see you in the next episode.